You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mother of four, and a teratogen information specialist. So basically what I do is I talk to people, so patients, family members, providers, about exposures before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So a medication, a vaccine, a chemical that you work with. There's a whole range of things that we answer questions about. And of course, Mother to Baby is not the only group that answers questions about exposures. And today we have a special guest who's going to talk with us about exposures in general, not just in pregnancy or breastfeeding, but some of the exposures that many people call and ask about every day. Our guest is Dr. Stephen Dudley. He is the director of the Arizona Poison and Drug Information Center. He is a board-certified clinical toxicologist who graduated with a PharmD from the University of Arizona College of Pharmacy in 2015. He completed a toxicology fellowship with the Arizona Poison and Drug Information Center in 2017 and spent 9 years working in retail pharmacy. Dr. Dudley, welcome to the show.
Thank you so much. Happy to be here.
Alrighty, so let's jump right in. What is a poison center?
Sure. Poison centers there's 55 poison centers across the U.S., and pretty much we are a center staffed with healthcare professionals, whether they're pharmacists or nurses for the most part, and we answer questions about poisonings. And, to keep it very simple, there is this guy way back when named Paracelsus. He's considered the father of toxicology. And in short, he had a saying that essentially nothing is without poison. Everything has poison. The dose makes the poison. And so if the dose makes the poison and everything is potentially a poison and you're a poison sensor, then you get caught about everything. And that's pretty much what we deal with. But we're here for pretty much any sort of exposure or information question to just about anything that you can consume or can consume you.
That definitely sounds like a wide range of things that people can call about, topics, things that people ask about. But before we get to that, who can call a poison center and when?
Absolutely. So the poison centers are all 24/7, 365. So whenever you have a question, you can always call the poison center day or night. And anyone within the U.S. or any of its territories with a cell phone or a landline can always reach their nearest poison center.
Oh, landline. Now you're talking the old ways when we had yes, young people.
We don't discriminate.
Yes, they are. Those still exist, the landlines. Good to know. So now let's get to the good bit. What types of questions does your poison center receive?
Yeah, so, this really goes back to the Paracelsus thing, right? Where it's really anything and everything. We have two types of quote unquote questions. One are one's an information question, and that means, I have a question about this medication or this thing. I'm not exposed to it. I'm not in any danger, but I'm just curious about it. And then the other set of questions is the exposure question. I have been exposed, or for instance, a hospital will call us and say they have a patient who's been exposed to X, Y, or Z. What do we do? And so when you kind of break that down and look at those all together, overdoses or exposures are really a function of access, meaning that things people have access to, they will be exposed to. So far and away, over-the-counter medications such as ibuprofen or acetaminophen are our most common call. And then after that, it really looks at household cleaning supplies are kind of a big one, as well as people's medication. So that could be their own personal medication, if they have small children, the parents' medication, or even the grandparents' medication. And then lastly, because we are in Arizona, and this is the mecca of all things creepy crawly in the U.S. We get a ton of questions related to envenomation. So rattlesnake bites, scorpion stings, spider bites, those type of things.
What's the most interesting question that you can recall?
Yeah, I hate to give you a cop-out answer, but I really can't choose one. There's so many different things, and I think it really relates to that exposure set of questions I mentioned earlier, where you have people who are exposed to something, and what people may not realize is that yes, we answer a lot of calls from the general public, but we also answer a ton of calls from hospital nurses, physicians, pharmacists, et cetera, who are looking for us to actively help take care of their patients, and we will do that during their stay. And that tends to be to where the crazier stories come from. And just off the top of my head, we had a case where there's someone who reportedly drank quote unquote cleaning solution and was unconscious, unresponsive. They had a low blood pressure, which if you're thinking cleaning solution, you think, okay, bleach, 409, Windex, like none of those things would do that. Come to find out it was actually a street drug called Poppers, which contains ammo nitrite, which, would do all those things. But because of legality reasons, the bottle doesn't say, hey, this is a bottle of Poppers. It says cleaning solution, not for human consumption, but it comes in, the same size as like a 5-hour energy, right? And I've never seen cleaning solution come in that small of a bottle because it's not actually meant to clean. And so that was a very interesting case of how that worked out. We've had cases where things that are illegal in the U.S. Or chemicals that are illegal for sale in the U.S. still are here, whether it's from before the new lawmaking, or just from other countries, where we had a case where someone was working in a garage, accidentally ingested some paint stripper or paint remover, and the interesting part about that is it has a chemical in there called methylene chloride, and it slowly converts to carbon monoxide. And so you don't think about carbon monoxide poisoning like from fires, things like that. You don't think about that in the liquid, but it does do that. And then I think finally, just the calls we get from other poison centers. So, like I said, we are the experts, especially in rattlesnake and scorpion stings, right? But, other parts of the country don't have those types of worries. And so I remember I personally got a call from the director of the Georgia Poison Center at about 7 a.m. because they had a patient who traveled from Mexico back to Georgia, carried unknowingly a scorpion in their bag and was stung. And so, Georgia, they don't have bark scorpions, so they weren't like, what do we do with this? How do we manage it? So I'm literally walking this other poison center through the management because we see thousands of these things a year, where they see none.
That's so interesting. I know, like you said, you get hospital calls, and of course, from the general public, it's so cool to think about other poison centers that don't have the experience, right? Like you said, so for us, it's rattlesnakes, scorpions, and stuff. I know some parts of the country there's Lyme disease present more in some states than others. So it's cool to know that the poison centers can collaborate among themselves to still make sure patients get the best care. And because we're talking about things like rattlesnakes, I will make a shameless plug. MotherToBaby has a baby blog that I wrote actually about rattlesnakes during pregnancy and breastfeeding. So make sure you check that out. But sorry to segue, Dr. Dudley, please go ahead.
Oh, no, that's a great point. We love the work that y'all do. And I'll make the shameless plug in case the listeners don't know. So MotherToBaby Arizona is actually housed at the Arizona Poison and Drug Information Center, and we are one of the very few and unique poison centers in that regard. And the expertise we get from Chris and her staff is unmatched, as we'll kind of dive a little bit into later, I'm sure. But yeah, regional expertise is definitely a thing. Just like we have rattlesnakes and scorpions, like you mentioned. We don't have marine. Like I wouldn't know what to do with a stonefish bite or a jellyfish. We don't have those in Arizona.
Right.
Harmful algae blooms. We don't typically have those as much as some of your other centers may have on the coast. So, we all definitely pitch together. And if we don't know something or don't have an extra expertise, we are really good at, looping in other centers, other toxicologists who have that expertise. So no matter where you're at, you're getting the best possible care.
So let's go back to something that you already mentioned, which is access. So people tend to take the things that they have available or the things that they can easily get. So one of those things I know is acetaminophen, and a brand name for acetaminophen is Tylenol. What is that? What is acetaminophen? What is it used for? What kind of questions does the Poison Center get about acetaminophen?
Sure. So acetaminophen, plainly speaking, is a pain reliever and fever reducer. It actually has a very, very interesting past that we probably don't have time to get into today. But long story short, acetaminophen has kind of been through the ringer in terms of how it got to the market and it stayed on the market. It's kind of one of those drugs where even though it's been around for, I mean, for 100+ years, we still to this day don't quite know how it works or what it does. We have hypotheses for sure, but even as recent as last year, there's a whole new hypothesis on why acetaminophen relieves pain. But be that as it may, that's really what it's used for. It's available over the counter. It's really available almost anywhere. We kind of joke there's nowhere you can go where you can't get acetaminophen, it feels like, because we just get so many questions about it. In terms of the questions we do get, again, kind of breaking it down into purely information versus exposure. By far, the most common information question we get is, hey, I have a child and I need to give acetaminophen. What is the dose?
Mm-hmm.
Because if you look on the back of the package, it'll say, oh, give 10 to 15 mg per kg. And people look at that and say, well, what does that mean, right? What is
Right.
mg/kg? I know. And so they call us, and we were more than happy to do that. And so what we'll do is we'll ask them, okay, how much does your child weigh? And then we'll go ahead and we'll convert that child's weight, because it's America and we use pounds and we refuse to use the metric system, like the rest of the world. But that's our freedom. And so we'll convert the pounds to kilograms and then do the calculations for them and say, hey, this is how much you should give that child. And so by far that, and then second most common question is, hey, I took X drug, can I take acetaminophen now? And, that's a great question, because people tend to not think that acetaminophen can be dangerous because it's over the counter. That's
Right.
absolutely not true. When you're taking it as prescribed, or, by the label, by the instructions on the package, yes, acetaminophen has a great safety profile. It's very unlikely to cause harm, but drug-drug interactions do exist. People who may have certain medical conditions like liver failure or liver disease definitely can play a part and make it more dangerous than it would be for the quote unquote, otherwise rest of the population. And also, when we look at just how much are you taking, acetaminophen is in so many products, people may not realize that it's also there. So one of my favorite examples is, all the Alka-Seltzer Plus or your cough and cold plus, anything with that where you think about it, like, oh, this is cough medication, oh, this is cold medication, this doesn't have acetaminophen in it, and you load the label, and surely enough, it does. So not just taking the acetaminophen by the package instructions, but also knowing, are you getting that elsewhere, so you're not going over that daily dose, which I like to say is no more than 4 grams per day for adults. And then, for children, we really try not to go over 100 milligrams per kilogram per day, or about 1,600 milligrams per day total.
I think that's such a great point, because that's something that we like to remind the people that contact MotherToBaby as well. It's like, yes, we can talk to you about one product. So, sometimes we'll get questions about, of course, things like Tylenol. And again, we always tell people, make sure you check with your provider. And actually, we did 2 podcast episodes about acetaminophen, one in pregnancy, one in breastfeeding. So in case you are interested in those, episodes 37 and 38. But we also remind people too, make sure you look at all the products that you're taking. It's such a good point because sometimes you don't think about it, right? If it's not Tylenol, cold and flu, if you're taking, like you said, a different brand name, it may not cross your mind. So always a good thing to make sure you have that. And I also didn't think about acetaminophen with other medications, so I have 4 kids. My 3rd child now takes a prescription medication. And when the prescriber was telling me about the medication, he said, hey, when he gets a fever, what do you give him? Do you give him Tylenol? Do you give him ibuprofen? It didn't even occur to me that we would have to think about that in the context of his prescription. So again, a good reminder, make sure you check with somebody. And like you said, the Poison Center gets those calls, those drug interactions. Is what I'm taking going to possibly interfere with something else that I may take? And it's such a good thing to know and not something that we think about every day.
Absolutely. Absolutely. Well said.
So thinking about the number of calls that the Poison Center gets about acetaminophen, again, with access, it's such a common thing. That must be a huge number of calls, right?
Absolutely. So looking at all the poison centers, all 55 of us nationwide last year in 2022, there were 133,259 calls to the Poison Center regarding acetaminophen. And I say calls, I mean like actual exposures. And of those exposures, over half, roughly 78,000 of those, resulted in a hospital visit. And of those hospital visits, there were roughly 500 deaths last year, unfortunately.
Wow.
And so, again, acetaminophen is one of those things where, when taken as prescribed or as directed, good safety profile, but when taken in excess, whether it's intentional through run product or unintentional through multiple sources leading to too much acetaminophen over a long period of time, it can have consequences. So making sure you're talking with your healthcare provider, talking to whoever runs your medications, whatever healthcare professional you talk to with your medications, can go a long way, because we see this all the time.
Wow. It's, again, just sort of putting it into perspective with the numbers. That's startling. When I think about things that people die from, I must admit that acetaminophen isn't the first thing that jumps to my mind. So it's just, like you said, just a good reminder to make sure we know what's going in and how much. Something else that you mentioned earlier, that really interesting case where it was poppers, but it was labeled as cleaning solution. And we hear about that sometimes, of course, working with the Poison Center, that sometimes there is a water bottle, but it doesn't have water in it. It has a cleaning solution or it has bleach. So what are some tips for appropriate medication handling and avoiding unintentional ingestion? So like, you're going for that sip of water, but it's actually bleach.
Oh, yeah, that happens all the time. It's kind of crazy how often that really happens. And everyone thinks, oh, that would never happen to me. People probably listen to this right now and think, well, that would never happen. I guarantee you it will happen to you or someone in your lifetime. So yeah, really, when we talk about tips for appropriate medication handling or safe storage, et cetera, a couple of things for everything. One is, always try to keep the medication in its original container, especially if you have young children, and especially if that original container is a child resistant container,
right,
meaning that it's really hard for the vast majority of children to open it up in a very quick manner. For those who are probably listening who may have small children, I think you all know, Chris, I'm sure you know from experience, you turn your back for a second,
yep,
and young children become elite track stars, right? they are so fast, and they are so incredibly yes, yeah. And so any sort of barrier you can to make sure that they don't get into that medication is great. So lock cabinets, keeping things high out of reach. Again, if you have small children, I think we all have a tendency to put things underneath the kitchen cabinets, cleaning solutions, things like that. Bad place if you have small children. They are exploratory, and that's primarily what all of our calls from the 0 to 5 year old age range is that these children are being children against these things that may look attractive, whether it's bright colors, the packaging, or whatever it may be. Safe storage, keep things in locked cabinets or child-resistant containers, keep them in original containers when possible. Also, if people use things like pill minders or things that help them take their own medications, really try not to mix medications. What we'll constantly see is, it's more so for adults now, when we see adults kind of put medications, I have 4 different medications, I put them all in one container or one area because I know I take them anyway. What happens is if you accidentally double dose that or accidentally take too much of those units, well, now it's not just one medication we're worried about, it's 4 or 5 or 7 or whatever that number may be. So, again, I know that these things can be incredibly convenient and they should be used when there is a benefit, but just understand that there's risk along with that, and just being sure that those things are easily identifiable and hard to get into are the 2 best things that you can possibly do.
And as you also know, especially with kids, and it does happen to everybody or nearly everybody, it certainly happened to me. I poured a dose of medicine and then my son tried to swipe the bottle and tried to, take what was left. And so even if you're absolutely perfect with handling, storing your medications, sometimes it goes in, there is an ingestion. So if that were the case, what would somebody do if there was either an accidental ingestion, an overdose, if a child got something they weren't supposed to have, what should they do?
Yeah, you're absolutely right. It happens all the time. So the first thing to do is remain calm, right? If you see an ingestion or even have a fear or suspicion that your child got into something, the best thing you can do is, one, gather all the evidence, meaning that gather the bottles or the containers or whatever you think may have been involved, and then give the poison center a call. Like I said, we're here 24/7, 365. No matter where you're at, you just dial 800-222-1222, and you will get a poison center near you. What we're going to ask is, first, how's your child doing? Luckily, most of the things that we discuss and talk about or concerned with don't happen that quickly, where we're talking about a matter of seconds to minutes. It's mostly minutes to hours as the drug absorbs. And with the acetaminophen, as example, it's even longer than that. So what we want to make sure is we don't want you to be overly concerned if there's not an issue, but we also don't want you to be under concerned if there really is an issue. So
Right.
What we'll always ask is, step one, how's the child doing? Is the child fine? That's what we care about the most. And if they're not fine, we're going to connect you to 911 and get you to the hospital. But again, 99% of the time, if you call us right after it happens, your child's going to be appearing just fine. So then we're going to ask you, okay, what was involved? Name of the medication, and not just the name, but we'll often ask you to turn that container around and read us the ingredients on the label. Because again, there are so many different ingredients in different types of products, even with the same name. So just because it says, X brand of cough medicine or X brand of cold medicine, it may have antihistamines in it. It may have pain relievers in it. It may have this or that. So we want to make sure we know exactly what we're talking about. The next thing we're going to ask is, how much could their child possibly have gotten into? And this, we're looking for worst case scenario. And so having an understanding, a rough understanding as to how much they took, if it was a witness ingestion, or how much is remaining in the bottle, and how much did you think was in there before your child could have gotten into there. And we'll sort of do the math on that and try to figure out, okay, hey, what's the worst or what's the most this child could have gotten into? And then lastly, we'll ask for the child's weight. And so we'll take everything into consideration. We'll look at these weight-based dosing metrics and say, okay, hey, if your child got this much, this is what I would say to do. Do you think that's possible? And we'll kind of work our way back down from worst case scenario to best case scenario. Our job here is to triage and help patients stay out of the hospital when they can, but we also don't want to make any assumptions. We will always err on the side of caution. But I can tell you, the vast majority of times, most of the times children get something. Luckily, it's not enough of something. We talk about some of these higher safety profile medications that we can safely watch at home. We'll give you instructions on what to do, things to look out for, and then we'll call you back and make sure that your child's still doing well. Now, there are instances where, there is a list of medications we call one pill can kill. And so those are medications that in children can definitely be catastrophic, even if it's only one. We think of like our opioids or some of our diabetic medications. Those will say, hey, you got to go to the hospital right away. But more often than not, we can safely watch. If we can safely watch these injections at home, we will, and we will give you guidance every step of the way to help you manage that.
And that's one of the things I think is so special and so helpful about the Poison Center. Again, you'll send them to the hospital if need be, absolutely. But very often it sounds like you don't need to do that, but there's still that support. It's not, you're going to be fine, have a good night. It's, we're going to call you at these intervals. We're going to make sure that you're still doing okay. And that must be quite a money saver for programs. Can you speak to that at all?
Absolutely. Hospital visits, ED visits, they're not cheap. And that's a big problem that most people face, and I think a big barrier. And so when we talk about just our center, last year we kept roughly 60% of folks who called us from home, we kept at home. Wow. And if you kind of calculate that out by the number of calls we receive and the average cost of the ED visit in Arizona, that's $24.5 million we saved Arizonans just last year in unnecessary healthcare costs. So it's no small thing by any means.
I would agree. Wow. Over 24 million. That is amazing. Dr. Dudley, thank you so much for all this information today. But before you go, is there a final thought you would like to leave our audience with?
Yeah, I would say when we're talking about calls to the Poison Center, I think one of the big things that parents may feel is, am I going to get in trouble for this accident that happened? And I want to just reassure everyone listening right now, never feel afraid, no matter what the circumstance is, to give us a call. Our concern is the safety and well-being of the folks involved in our care. We are not here to pass judgment. We're not here to get anyone in trouble. We're here to take care of you and your children. So, never feel like you can't call us. Never feel like you're going to get in trouble with that. The last thing we want, and we've seen this happen, unfortunately, is for an ingestion or an exposure to occur. Someone feel like they can't call the Poison Center for fear of whatever, and taking something that would have been a relatively mild intervention to make that child better turn into something so much worse because we effectively ignored the problem and we weren't able to give that expert recommendation. So give us a call. We're always here 24/7, 365, 1-800-222-1222.
Excellent. And thank you again, Dr. Dudley, and good luck. I know that rattlesnake season is upon us.
Absolutely. Thank you so much for having me.
And thank you for listening to this episode of the Mother to Baby podcast. If you have an idea for a podcast or if you want to be on the show, let us know. You can email us at contactus@mothertobaby.org. Of course, you can listen to past episodes of the Mother to Baby podcast. So we are available on iTunes, Spotify, and however you listen to podcasts. Don't forget to hit that subscribe button so you never miss a new episode. And of course, Mother to Baby is here to answer your questions. So feel free to give us a call at 866-626-6847. You can text us at 855-999-3525. You can visit us on our website, mothertobaby.org, where you can find all of our contact information, lots of other information pages, our fact sheets, our baby blogs, and our podcast episodes. So until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.